Well, healthcare made headlines all throughout 2019.
Yeah, Fox News correspondent Jackie Heinrich has more.
U.S. health officials found low levels of a potentially cancer-causing chemical in Zantac, a popular heartburn drug. The FDA said samples of Zantac contained a contaminant known as NDMA, a classified probable human carcinogen. The same chemical has been linked to dozens of recalls of prescription blood pressure drugs in the past year. Drugstore chains like Walmart, CVS Health, Walgreens, and Rite Aid pulled Zantac products from their shelves. The U.S. Department of Health and Human Services released new opioid treatment guidelines. The agency recommends that opioids should not be tapered rapidly or discontinued suddenly due to the risks of significant opioid withdrawal. The wide-ranging guidelines, which pinpoint when to consider tapering and steps to consider before deciding to taper, also outline 6 steps doctors should take before initiating a taper, including discussing it with the patient. The number of lung illnesses linked to vaping increased across the United States this year. As of November 20th, nearly 3,000 cases of vaping use linked to lung injuries have been reported to the CDC, and 47 deaths have been confirmed in 25 states and the District of Columbia. To curb vaping, some states have enacted flavored e-cigarette bans, while Massachusetts and California cities have taken steps to outlaw e-cigarettes altogether. A new drug to treat cystic fibrosis patients was approved by the U.S. Food and Drug Administration. The drug, called Trikafta, is the first triple combination therapy available for patients aged 12 and older who have the most common cystic fibrosis mutation, which is about 90% of cystic fibrosis patients, according to the FDA. Trikafta's approval was based on results of 2 clinical trials involving 510 patients. A baby girl born at Cleveland Clinic made history this year by becoming the first baby in North America delivered by a mother who received a uterus transplant from a deceased donor. The mother was part of a groundbreaking research trial that involved 10 women with uterine factor infertility, or UFI. Women with UFI don't have a uterus or had their uterus removed, so they aren't able to get pregnant. This was the second time worldwide a woman's been able to give birth following the transplant of a deceased person's uterus. The first case was reported in Brazil in December of 2017.
And the flu continuing to pose a threat, with deaths and hospitalizations being reported across the country. Flu season will continue into 2020, so make sure to get that flu shot and wash your hands regularly. In New York, Jackie Heinrich, Fox News.